Millions of Americans who suffer from chronic pain may be improperly prescribed opiates, strong painkillers with serious side effects, as potentially addictive as heroin.
At the point at which a physician recognizes that their patient has developed addiction to these medications, the horse is already out of the barn.
John Faber's series of articles for Everyday Health partner MedPage Today and the Milwaukee Journal Sentinel have led to a Senate investigation into whether payments to medical groups from drug companies are influencing the prescribing guidelines issued by those groups.
At some point, you have to wonder about when the money starts influencing the message. And all I can say is that you know, the companies that make these drugs have paid millions of dollars to the organizations that have pushed this message. These are the leading organizations that advocate for pain, and they set guidelines for doctors in practicing medicine. Many doctors look at these guidelines and use them to decide whether to treat their patients with these drugs.
In part, thanks to those guidelines, opioids, also called narcotics, are being prescribed more than ever. In 2010, pharmaceutical companies sold 4 times as many prescription painkillers compared to a decade earlier. The leading drug, OxyContin, saw $8.4 billion in sales in 2011. Addiction has also increased, with a recent study published in the Journal of American Medicine finding that every hour a baby is born addicted to opiates.
The pharmaceutical industry really is trying to convince doctors that these medications are not addictive, that addiction is something that exists just in the patients. But the fact is that these medications are inherently addictive. As I mentioned, they're related to heroin.
Andrew Kolodny, who founded Physicians for Responsible Opioid Prescribing, says pharmaceutical marketing is fueling an epidemic.
The CDC is telling us this epidemic was caused by overprescribing, and that physicians changed the way in which they were practicing. And that change in practice was not driven by new evidence suggesting these were safer than we had thought. It was driven by marketing and by education sponsored by drug companies.
In response to the Senate investigation, several of the parties, including 2 pharmaceutical companies, have said they are cooperating. Not all people who use these prescription painkillers will become addicted, and for some, there is a legitimate need for the use of these drugs at times. Chronic pain is complicated to treat. What's clear is that there's an enormous need for better options. With Everyday Health, I'm Stephanie Tsai.